Well, it's time for a health report, and joining us now is Africa 54 health correspondent Lino Madu with some disturbing news in the battle against polio.
That's right. The World Health Organization has confirmed a third case of polio in Nigeria. The Rotary Club in Nigeria says the new case was found in an area recently liberated from Boko Haram. Nigeria was once a global epicenter of the wild polio virus, and it had been declared polio-free last year. But 2 cases were discovered last month among refugees in the Borno Northeast region. A new emergency immunization drive has vaccinated more than 1.5 million children in Borno State. The WHO says the virus has been circulating undetected for 5 years in the region. The immunization campaign is set to spread across the country with a plan to reach 25 million children before the end of the year. The World Health Organization says the yellow fever outbreak in Angola and the Democratic Republic of Congo does not constitute, quote, a public health emergency of international concern. The WHO says vaccination has been the cornerstone of the response. There has also been an intensified response around vector control, enhanced surveillance, technical assistance, and the strengthening of lab capacity, as well as the deployment of mobile labs. The organization says these steps resulted in some positive trends in both countries, with the last case in Angola documented on June 23rd and in the DRC on July 12th. But the WHO says these gains must be maintained.
Although the yellow fever situation is improving, the committee agreed that this event continues to be serious and requires sustained control measures. But again, stress does not constitute a public health emergency of international concern at this time.
We project at the moment that there are more than 6,000 suspected cases. There's been a lot of work to scale up lab capacities both in DRC and Angola, and the labs are currently able to confirm the existing caseload of cases, and we have confirmations of about 1,000 cases now in both countries. But you're quite right that there may be cases that are going undetected, which is why we've tried to step up active case surveillance in both those countries and in surrounding countries.
More than 400 people have died in the DRC and Angola since December, in the worst outbreak of yellow fever in decades. In Kenya and elsewhere, first aid responders constantly put their lives on the line to save the lives of strangers. Collapsed buildings, terror attacks, accidents and other emergencies are an unfortunate part of life. At this site in Huruma in Nairobi, Red Cross volunteers and the Kenyan Army are racing against time. Conspicuously standing out in the gathering is Brenda Alaka. She started volunteering for the Kenya Red Cross in 2007 and was inspired by her father.
My dad was the first person to teach me how to wear gloves. And because he was the orthopedic surgeon, he also called me and told me, I want to teach you how to tie dislocations if someone has fracture. And if you see even right now in my area of work, I really like mobilizing fractures.
The 26-year-old currently volunteers as an emergency dispatch operator. Her work is to coordinate personnel and match them up with crises. Being constantly in the line of danger, these local heroes sometimes need counseling to cope with trauma.
When Uruma happened, I handled bodies to the age of 9 months. So these were infants. And you know I'm a parent. So it really disturbed me, but I thank God I went through counseling, debriefing, and now I'm okay. But Huruma was my worst experience.
This line of work is far from glamorous. Some even die in the line of duty, like the Red Cross hero, Michael Sululu.
There was an oil tanker on the highway in Bungoma that had gone off track and had an accident, and there was spillage. The police came in the process started shooting in the air, and I think one just lost it and shot, and Michael, while attending to a wounded person, was unfortunately shot at. He lost his life on the way to hospital.
Despite the risks, volunteers such as Brenda focus on the rewards of saving people's lives with each opportunity.